Treponema pallidum,
I, Ada Hepler,
Cameron Brown,
Emily Wedham,
Ryan Johnson,
and Luke Ruel.
Treponema pallidum is a gram-negative spirochete bacterium containing DNA that is about 6 to 15 micrometers long and about 0.1 to 0.2 micrometers wide, and is motile using their flagella kept within their paraplasmic space within the membrane. This organism is a microaerophile that uses the process of fermentation but can tolerate low levels of oxygen. This organism is also an obligate parasite that invades your body through unprotected sexual activity and causes a sort of sexually transmitted disease, or STD, referred to as syphilis.
Protected sex. It adheres to the cell bodies in one of two ways, either tip to tail or along the length of the host cell. Treponema pallidum replicates through binary transverse fission. Next slide. Treponemes are highly invasive pathogens that disseminate quickly after inoculation, meaning that the cells themselves are short-lived. The unique structure of the treponemal outer membrane seems to be the cause of evasion of the host's immune system. Treponema pallidum lacks classical lipopolysaccharides. They possess lipoproteins that induce inflammatory processes in the body. They are considered a microaerophile and need those specific conditions to replicate. Next slide. The virulence factors for Treponema pallidum include its membrane, which is 100-fold less than the typical gram-negative bacteria, which makes it less of a target for host immunity. Because the membrane has less surface area, it is able to evade host immunity very well. Due to evolution of the bacteria, newer strains have developed drug resistance, specifically to penicillin, which is most commonly used to treat Treponema pallidum. Next slide.
disease development. Treponema pallidum causes the disease syphilis. The incubation period of syphilis ranges between 10 and 90 days, with 21 days being the average incubation period. The primary, or first stage of the disease, begins 10 to 90 days after being infected. The primary stage is marked by the appearance of a single canker, which is a firm, round, and painless sore that appears at the location where syphilis entered the body. Since cankers are painless, they often go unnoticed, especially if they are in hard-to-see areas like the vagina or anus. Cankers usually heal in 3 to 6 weeks. If the syphilis infection is not treated during the primary stage, it will progress to the secondary stage. The secondary stage is the stage in which the person is the most contagious. It typically starts with the appearance of a rash that appears as rough, red or reddish-brown spots. The rash occurs all over the body, including the palms of the hands and the soles of the feet. The rash appears 2 to 8 weeks after canker development. Since cankers take 3 to 6 weeks to heal, the rash can appear before the canker is fully healed. The rash typically heals within 2 months. Small open sores on mucous membranes can also be present during this stage. Other symptoms the infected person could experience during this stage include fever, sore throat, weakness, weight loss, hair loss, swollen lymph nodes, and nervous system symptoms. The secondary stage of syphilis can have complications that linger for months or even years, including complications of the bones, hair follicles, joints, eyes, and brain. If the syphilis infection is not treated during the secondary stage, it will progress to the latent stage. Next slide. The latent stage can last from 1 to 20 plus years. During this stage, the infected person is asymptomatic but still contagious. There are no visible signs of syphilis during the latent stage. Syphilis antibodies can be detected in an infected person, but syphilis itself cannot be. Approximately 15 to 30% of untreated syphilis cases progress to the tertiary stage. The tertiary stage is the most destructive and can be fatal. During this stage, syphilis can affect multiple systems, including the nervous system, cardiovascular system, and the skeletal system. Gumata, which are large sores, can develop on the skin and inside the body. Symptoms include numbness, dementia, vision problems, and problems controlling muscle movements. During any stage of a syphilis infection, syphilis can spread to and infect the nervous system and/or the ocular system. Symptoms of neurosyphilis include headache, altered behavior, paralysis, sensory deficits, hindered muscle coordination, and dementia. Symptoms of ocular syphilis include vision changes, decreased visual acuity, and blindness.
Disease spread. Treponema pallidum bacteria cause a sexually transmitted disease, most commonly known as syphilis, or it's also nicknamed the Sif. During 2018, there were 115,045 reported new diagnoses of syphilis in all stages, compared to 38,739 estimated new diagnoses of HIV infection in 2017 and 583,405 cases of gonorrhea in 2018, just to put it in perspective. Of all syphilis cases, 35,063 were primary and secondary syphilis, and these are the earliest and most transmissible stages of the disease. In 2018, the majority of primary and secondary syphilis cases occurred among gay, bisexual, and other men who have sex with men. In 2018, men who have sex with men accounted for 77.6% of all primary and secondary syphilis cases among males in which sex of the sex partner was known, meaning males. In recent years, the rate of primary and secondary syphilis has been increasing among men who have sex with men, as well as heterosexual men and women. Congenital syphilis, which is syphilis that is passed from pregnant women to their babies, continues to be a concern in the United States. During 2018, 1,306 cases of congenital syphilis were reported. This infographic on the right side of the screen from the Center for Disease Control, it's just showing how congenital syphilis cases have almost tripled from 2014 to 2018. How does it spread? Syphilis is transmitted from person to person by direct contact with a syphilitic sore, which can also be known as a canker or an ulcer. Cankers can occur on or around the external genitals, in the vagina, around the anus, or in the rectum, or also in or around the mouth. Transmission of syphilis can occur during vaginal, anal, or oral sex. In addition, pregnant women with syphilis can transmit the infection to their unborn child. Typically, it takes around 21 days from contact for symptoms to show, but it also can take anywhere from 10 to 90 days. There's no set time limit for this. Syphilis has often been called the Great Pretender, as its symptoms can also look like many other diseases. There's also no non-human reservoirs for this bacteria, and it has a 50% infectious dose of 57 bacterial cells. And there is also no known lethal dose for the bacteria. Syphilis and HIV. In the United States, approximately half of men who have sex with men with primary and secondary syphilis were also living with HIV. In addition, men who have sex with men who are HIV negative and diagnosed with syphilis are more likely to be infected with HIV in the future. This is because of the genital sores caused by the bacteria make it easier to transmit and acquire HIV infection sexually. There is an estimated 2 to 5 times increased risk of acquiring HIV if exposed to the infection when syphilis is present. Furthermore, syphilis and certain other STDs might be indicators of ongoing behaviors and unsafe sex exposures that place a person at greater risk for acquiring HIV. The presence of either of these diseases correlate with increases in other STD, STI infections. And then this infographic on the right is just kind of relating the two diseases together. Limiting disease spread. The best ways to prevent the spread of Treponema pallidum infections include abstaining from sex, reducing the number of sexual partners, mutual monogamy, avoiding anal sex, use of condoms, dental dams, and gloves, getting tested routinely if sexually active, keeping partners informed of sexual history, seeking testing when infection is suspected, receiving treatment when testing positive for syphilis, and then lastly, being aware of the symptoms and what cankers look like. On the right is an image that also shows what the protective female condom, male condom, gloves, and dental dams may look like.
This video is an overview of syphilis signs and symptoms.
Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. Dr. Stacy Rizza, an infectious diseases specialist at Mayo Clinic, says syphilis affects men and women and can present in various stages.
Primary syphilis causes an ulcer, and this sometimes isn't noticed because it's painless and can be inside the vagina or on the cervix. After a few weeks, 2 months, they can get secondary syphilis, which is a rash.
It may then progress to latent stage syphilis, and finally, the most serious stage, tertiary. Pregnant women are not immune to syphilis. Congenital syphilis can lead to miscarriage, stillbirth, or infant deaths. That's why all pregnant women should be screened. Syphilis is preventable and treatable. As for prevention, Dr. Rizza recommends barrier protection during sex.
And that's during oral sex, anal sex, vaginal sex, using condoms, dental dams, and any other barrier protection.
For the Mayo Clinic News Network, I'm Vivian Williams.
So in that video, they were also talking about congenital syphilis, and they recommend that any pregnant women should be tested for it, whether they are showing signs and symptoms or not, just to make sure that this STD is not passed on to their child.
Syphilis diagnosis. Screening tests are used to detect potential health problems in an individual. Examples of screening tests for syphilis include venereal disease research laboratory test, the VDRL test. This test checks blood or spinal fluid for antibodies that can be produced in people who have syphilis. The rapid immunochromatographic test is a blood test that tests for antibodies, but this test can be done at a regular doctor's office instead of a hospital. The rapid plasma reagent test is just another test for antibodies. The enzyme immunoassay, or the EIA test, is a blood test that checks for syphilis antibodies. A positive EIA test should be confirmed with either the VDRL test or the RPR test. Dark field microscopy. This test uses a special microscope to look for the syphilis germ in a sample of fluid or tissue from an open sore. This tests for early stage syphilis. A picture of a positive result is on the top right. Fluorescent treponemal antibody absorption, FTA-ABS. This test also checks for antibodies, but it is only accurate 3 to 4 weeks after exposure. The Treponema pallidum particle agglutination assay, or the TPPA. This blood test also checks for antibodies. It is used after another method tests positive for syphilis. This test is not done on spinal fluid, so it is only a blood test. And lastly, the lumbar puncture or spinal tap. This is where a sample of spinal fluid is taken and used to diagnose tertiary syphilis. Next slide. Treatment and prevention. The main medication to treat syphilis is through the use of antibiotics. The most widely used antibiotic to treat syphilis is the penicillin injection. Doxycycline, azithromycin, and ceftriaxone are all used if the host has an allergy to penicillin. They're used as alternate antibiotics. Late syphilis. Unfortunately, in cases where syphilis reaches the late stage, damage is irreversible, and treatment is more for easing pain. Prevention. As said before, do not have unprotected sex until all sores on your body are healed. People with syphilis have a higher chance of contracting HIV, so practice safe sex. Use condoms or dental dams if you are going to have sexual intercourse. Do not share needles. Treponema pallidum can spread through the sharing of needles. And lastly, get your partner screened for syphilis if you are positive, and tell all other sexual partners of your sexual history. The picture on the top right shows the amount of people infected with syphilis from 2011 to 2015. In just 5 years, the number of cases increased by 67%.